Okay, this is the last lecture. Chapter 15 is the last chapter, and it's going to be a relatively short lecture. It's only 41 slides. Complementary and Alternative Medicine, Chapter 15. What is complementary and alternative medicine? Conventional medicine involves biomedically based medicine as practiced by holders of the MD, the medical doctor, or the DO, the doctor of osteopathy degrees, and their allied health professionals. Evidence-based medicine removes the collection, interpretation, and integration of the best research-based evidence in making decisions about the care of individual patients. Holistic medicine considers not only physical health, but also the emotional, spiritual, social, psychological well-being of the patient. Complementary and alternative medicine, also known as CAMS, involves use and practice of therapies or diagnostic techniques that fall outside conventional biomedicine. Domains, whole medical systems are healthcare systems that evolved independently of Western biomedicine, which include traditional Chinese medicine, Ayurveda, and homeopathy. Mind and body medicine include meditation, yoga, acupuncture, deep breathing exercises, guided imagery, hypnosis, progressive relaxation, qigong, and tai chi. Natural products include botanicals, vitamins, minerals, and other natural products. Manipulative and body-based practices include spinal manipulation and massage therapy. Other CAMS practices include movement therapies, traditional healers, manipulation of various energy fields, and putative energy fields. Ideals to provide health treatment that is natural, holistic, and promotes wellness. Back to nature backlash against modern technology, science, and biomedicine. Over specialization and fragmentation of modern medicine. Biomedicine may fight illness, but generally does not focus on producing an optimal state of vitality. Integrative medicine is a multidisciplinary approach to medicine that involves traditional biomedical intervention as well as complementary and alternative medical practices that have been proven both safe and effective. Vitalism is a concept of a general life force popular in some varieties of CAMS. Traditional Chinese medicine is an ancient integrated herb and acupuncture-based system of healing founded on the principle that internal harmony is essential for good health. Recent surveys conducted by the National Center for the Complementary and Alternative Medicine an estimated 38% of Americans use some form of CAM. CAM is used primarily for back problems, anxiety, depression, and headaches. Most users say they believe that combining alternative and traditional medicine will produce faster results. In 2008, more than 37% of responding hospitals indicated offering one or more alternative medicine therapies, up from 26.5% in 2005. Many of the same trends that led to the emergence of health psychology led to increasing interest in CAMS. The costly, impersonal nature of biomedicine, the adverse effects of treatment, the profit-driven nature of healthcare, a more activist, consumer-oriented view of the patient role. Differences in perspective and focus. Biomedical researchers demand evidence from controlled clinical trials. CAM practitioners often claim their treatment variables cannot be studied independently. Many CAM practitioners endorse interventions even when the evidence backing their claims is far from convincing based on conventional standards of science. CAM evidence is often based on informal case studies. Anecdotal evidence is research evidence based on informal case histories in which there is little or no objective documentation regarding a patient's diagnosis or the effectiveness of a treatment. Many CAM studies also rely on self-report and single outcome measures. Possible causes of improvement in a condition. The treatment is effective, of course. The patient was misdiagnosed to begin with. The illness improved on its own over time, and this is known as spontaneous remission. Cyclical conditions such as arthritis, sometimes it's good and sometimes it's bad. The placebo effect, placebo and nocebo effect. The nocebo effect is the phenomenon in which inert substances or mere suggestions of substances actually brings about negative effects in a patient or research participant. A good example of a nocebo is a concept of voodoo, where belief can hurt you instead of help you, as in a placebo. Any of the ideas of evil spirits that people believe and then allow these ideas to come true would be a nocebo. Many alternative explanations. So why do placebos work? Decreased anxiety. It decreases your anxiety through classical conditioning. Remembered wellness. Placebos may tap a natural inner pharmacy of self-healing substances. Any medical procedure can have a placebo effect. Critics contend that CAMs are entirely placebo-based. But then again, a lot of medicine is placebo-based as well. Acupuncture, originally practiced only in China, has become increasingly popular throughout Western industrialized nations. It has proved most successful in treating pain, although practitioners contend that it rejuvenates the body. An acupuncture session typically involves inserting thin acupuncture needles superficially or as deep as 1 or more inches, depending on the particular site and the practitioner's style of treatment. Which of the approximately 2,000 acupuncture points are selected along with the angle and the depth of the needle insertion varies with the symptom. Needles are sometimes twirled, heated, or electrically stimulated to maximize their effects. Acupuncturists often also incorporate herbal medicine and dietary recommendations in their treatment regimen. Acupuncture is the most heavily researched CAM technique. Thousands of studies have been published by acupuncturists, though most were uncontrolled pre-post treatment using sample sizes that were too small. Double-blind controls problematic. There is a lack of standardization of acupuncture sites. Sham acupuncture often works probably due to counter-irritation or the placebo effect. More than 100 randomized controlled clinical trials have been conducted with acupuncture and several meta-analyses. The bottom line seems to be that there is mixed results, that acupuncture provides some patients with some relief from osteoarthritis, back pain, migraine headaches, menstrual pain, tennis elbow, and postoperative dental pain. Percutaneous electrical nerve stimulation, or PENS, is a relatively new form of acupuncture. PENS uses acupuncture-like needles to stimulate peripheral sensory nerves to assist in the management of pain. PENS has been found effective in management of postoperative gynecological pain, migraine headaches, headache pain, and leg and foot pain from diabetes. Excluding 12-step programs, acupuncture is the most widely used CAM method for treatment of substance abuse. The goal of acupuncture treatment is reducing withdrawal symptoms, keeping abusers in programs, and continuing abstinence from drug use. There is mixed evidence, while there is some promise in treating pain, addiction, and depression, but overall effectiveness is controversial. Acupuncture is generally considered safe. Serious adverse effects are quite rare. Acupuncture patients may abandon conventional therapy and not receive a needed biomedical diagnosis or intervention. 35 states have established clinical practice standards for acupuncturists, and as you can see, acupuncture is very common in the Southwest, California, Arizona, New Mexico. Not so much in Utah or Nevada. Washington, Oregon, and Idaho, yes. No for Montana, Wyoming, North Dakota, South Dakota, Nebraska, Iowa, Kansas, Missouri, Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Kentucky, West Virginia, South Carolina, and New Hampshire. The rest of the states do allow it to happen. Actually, they all allow it to happen. There just aren't very many acupuncturists in the states that I mentioned. Stages of hypnosis. The pre-hypnotic stage is when the therapist engages in rapport building. The therapist will make suggestions and use imagery to induce relaxation and use focused attention to induce the hypnotic trance. During the treatment stage, the therapist will make suggestions and use imagery to reduce pain. They will use consolidation with post-hypnotic suggestions to be carried out after the hypnosis session has ended. During the post-hypnotic stage, the patient is alerted and given additional instructions, and this is a form of self-hypnosis, and released. Physiologically, hypnosis resembles other forms of imagery and deep relaxation. Researchers see hypnosis as a form of social interaction rather than an altered state of consciousness. We often allow ourselves to be in trance-like situations, such as when we are experiencing focused awareness, for example, high-stress situations. Suggestibility seems to be stronger in certain people, and these people are ones who are fantasy-prone and ones who are responsive to authority figures. Forms of progressive relaxation training. Mindfulness-based meditation is non-judgmental, in-the-moment stream of consciousness perceptions. Transcendental meditation is focused consciousness where the practitioner focuses on a single object or word called a mantra. And as you can see, the amount of oxygen that you consume while you're in deep meditation is relatively low as compared to the amount of oxygen that you're consuming before the meditation and after the meditation. The body's metabolic rate reflected in the amount of oxygen consumed decreased significantly in experienced meditators when they switched from simply resting to meditating. It rose when they stopped meditating, as we saw in the last picture, or the last chart. A meta-analysis of 26 controlled trials involving 1,264 hypertensive patients showed that CAM interventions based on relaxation training, meditation, and biofeedback were significantly more effective than no treatment in reducing systolic and diastolic blood pressure. Compared with credible placebo treatment, however, CAM interventions were much less effective. The difference between the treatments was statistically and clinically insignificant. Relaxation treatment may alter a person's emotional response to pain and other symptoms. It teaches the sufferers to reinterpret their pain, potentially. Relaxation and meditation may bolster the immune system. Relaxation training has been known to increase natural killer cell activity, and this is a study done by Kiecolt, Glasser et al. In 1985, and boost serotonin levels, and this was done by Alexander et al. In 1989. Biofeedback is a system that provides audible or visible feedback information regarding involuntary physiological states. Techniques, electromyography, feedback, and the other is thermal biofeedback. And this is how we're taking temperatures now. Really kind of interesting. I was watching somebody taking a temperature on 60 Minutes, and they must have been 2 or 3 feet away from this guy when they read his temperature, as weird as that is. And what they're using is biofeedback, thermal biofeedback. The effectiveness of biofeedback is beneficial in treatment of stress-related health problems. However, there are still too few well-controlled clinical outcome trials, as there are mixed results from a few studies. Lehrer and colleagues found that biofeedback can reduce autonomic arousal, anxiety, and stress-related disorders in some people, but it does not convey advantage over other behavioral techniques. The effect may be a result of enhanced relaxation, placebo effect, passage of time, or suggestion. Chiropractic is a complementary and alternative medicine approach to healing that is concerned with the diagnosis, treatment, and prevention of disorders of the neuromusculoskeletal system. Osteopathic medicine is a form of medical practice that provides all the benefits of conventional allopathic medicine, including prescription drugs and surgery, and emphasizes the structure and function of the human body. Straight chiropractors are traditionalists who continue to believe that misalignments cause pain and manipulation is the best form of treatment. A wide range of it works on a wide range of ailments from asthma to lower back pain to impotence. I knew a chiropractor once that claimed that he could stop a woman from going into labor or being in labor. He could stop her labor by adjusting her back. Interesting fella, as you can imagine. Mixers combine traditional manipulations along with broad range of CAM therapies, including massage, physical therapy, and nutritional therapy. Limited range of conditions, especially acute low back pain, headaches, and neck pain. Chiropractic work enjoys enormous popularity, especially for back pain. In 1974, Congress permitted Medicare payment for chiropractic work. Chiropractic is licensed in all 50 states. Critics charge that chiropractic is useless because misaligned vertebrae are common, harmless, and usually clear up on their own. However, retrospective and prospective evidence supports efficacy of chiropractic in treating low back pain. Naturopathic medicine is a system that aims to provide holistic health care by drawing from several traditional healing systems, including homeopathy, herbal remedies, and traditional Chinese medicine. Herbal medicine is derived from the leaves, stems, roots, bark, flowers, fruits, seeds, and sap of plants, herbs, also called botanicals, can be prepared or marketed in different forms. Herbal medicine plays a central role in Chinese medicine, Ayurvedic medicine, and Native American medicine. It takes several forms: tonics, tinctures, decoctions, and effectors. Physicians believe that herbal medicine is ineffective. Animal and human trials have shown that it is effective in treating arthritis, osteoarthritis, and burns, though there has been some mixed results. Nutritional medicine can be used to correct dietary deficiencies. Megadose therapy can be used to trigger specific therapeutic effect. Linus Pauling claimed that taking megadoses of vitamin C 10 to 15 times the required daily amount would control stress. Dietary medicine, correcting food allergies, sensitivities by staying away from trigger foods such as sugar, wheat, and dairy. That's usually what people are allergic to. Raw food therapy theory, macrobiotics, purports that raw foods are unhealthy and even vegetables should only be consumed after cooked. Yeah, cook me some lettuce. Substantial evidence that diet, foods, or supplements can have major effect on risk factors or certain diseases. High fiber diets, low fat diets, vegetarian, increasingly accepted treatments for managing cardiovascular disease, lowering blood glucose levels in diabetics, and reducing insulin needs. Some unregulated dietary supplements may contain hazardous substances. FDA warns against the use of certain herb supplements by those taking prescription medications. This was especially a problem with St. John's wort and with Prozac. And we're going to talk about that we're going to talk about that in drug use and abuse on Tuesday, but of course you guys aren't in the same class. Diseases that are strongly affected by lifestyle and environment are among those for which neuropathic treatment is most often reported to be effective. Allergies, fatigue, arthritis, asthma, headache, hypertension. Critics claim that unsuspecting consumers are flooded with unsupported claims and that herbs are not tested according to pharmaceutical standards. And of course, GNC got in trouble for their ginkgo biloba and their ginseng. They checked it and they found out that there was actually no ginkgo biloba in their ginkgo biloba, and there was also a very small amount of ginseng in their ginseng. With the ACA, there has been a major paradigm shift in medicine healthcare in the United States. With quality information on the internet, passive dependent patients have turned into activist health consumers. The traditional conventional medicine has had to at least acknowledge the complementary relationship with CAMs. The passage of medical marijuana laws in many states has alerted providers to the fact that tens of thousands are seeking alternative means of dealing with their woes. In the end, no single approach to healthcare has all the answers. The search for the best solution to a medical condition often requires a willingness to look beyond one remedy or system of treatment. And that is the end. I had a good time teaching health psychology. Good luck to everybody in taking the final test and getting your paper in. You guys have been a great class. I've really enjoyed this. And I will see you next semester, but I will be teaching from Iowa. I have been given permission to go completely online in the fall, so I will not be on campus, but I will be teaching a full load. So I'm not really sure what I'm going to be teaching yet. So just look for my name; it could be there somewhere. We may have two new professors for psychology. That should be exciting for everybody. We'll see what happens. We'll see if we can get them hired. We've already interviewed them both, and we've already accepted both of them. But whether they will accept the contract is another story. So send us all your positive vibes, because that's what we need. We need as much help as we can get. Jeremiah and I cannot handle the entire psychology load by ourselves. So I'll see you guys later. Take it easy, and you've been a great class. And let me see if I can get out of here. And the answer is, yeah, I don't know. Oh,